Good evening. How are you, doctors? I hope you are fine today. I hope you're ready for today's session. We'll discuss new topics and practice new scenarios. Today, we will start with how to explain a diagnosis. Whenever your task is to explain a diagnosis, what you need to do and what steps you need to follow, and also some tips and tricks and so, all right, will be included. So we'll start. Before we start, could you please confirm to me that you are able to see the screen? I shared the screen, the lecture with you, so anyone please inbox me to confirm that. Okay, thank you. So, key steps, how to do it. Whenever your task is to explain a diagnosis, they will give you a task card. They will give you a task card, okay, with a scenario. There will be a role written for you. Also, the scenario, what it includes, patient's name and what problem he has and what we decided for him or whatever, okay? And then your task at the end, what you need to do. You always have to stick to the task, okay? So let's say that you were given a certain disease and the diagnosis was so the disease X, for example, and your task is to explain it to the surrogate. So this is what you need to do. Number one, you have to provide information about the disease. The patient doesn't know much about it, and now you need to educate him about this disease. So you have to give him information in clear, simple language, so you need to avoid medical jargon. Number two, explain by drawing the information on the piece of paper if possible, okay? Try to get advantage of the pencil and exam before you enter into the exam room, because that will help you explaining what you need to explain, and also it will impress the examiners. Then explain incidence and prevalence of the disease. Like, for example, this disease is a common disease. It happens, or it affects males and females equally. Usually it affects this middle age group, or sometimes you deal with a genetic disease. It's, for example, an autosomal dominant disease, adult polycystic kidney disease. So you have to explain to them that this disease is a genetic disease. It's inherited in the family. It affects males and females equally. It manifests itself, or it's expressed in adulthood. Let's say you are explaining a disease which is an autoimmune disease, which is much commoner in females than in males. So like SLE or rheumatoid arthritis. So you say that this disease can happen equally in males and females, but it is more commonly affecting females, and so on, okay? So incidence, the prevalence of the disease, if you have simple information about it. And then explain the normal anatomy and physiology of the system, involved system. Let's say you're explaining TB. So the normal anatomy and physiology of the lungs, that they breathe in and out, they clear the air, they help the body to breathe in oxygen and so, but sometimes some infections can affect the lungs, which is this organ which is involved in doing this function. And when it affects the lungs, it causes a disease. The lung becomes diseased. So some symptoms like a cough and difficulty breathing sometimes, and so on, okay? So explain normally this organ, what it does, simply in layman terms, and what happened. It caused this organ to be unable to work normally, therefore so and so happen. So explain the pathophysiology and where is the defect. Please avoid medical jargon. It's difficult, but you have to get used to it, all right? Then explain the causes. Why? did this happen? The risk factors which led to this problem. Let's say you're explaining angina, for example. Risk factors, you need to explain to them that smoking, for example, eating unsaturated fats, uncontrolled blood sugar, and so on. Okay, diabetes, whatever risk factors, and any triggering factors. Let's say you are explaining a diagnosis of epilepsy and you are explaining the triggering factors. Okay, what triggers epilepsy? Flickering of light, staying late at night, watching TV late at night, and so on. All right. Then you explain the clinical picture of the given disease in the card, in the task card, presentation, signs and symptoms. Explain the complications of the disease. What may this disease cause? Okay, what complications, what problems may happen, and prognosis of the disease. Explain if further investigation needed in the future, maybe. Tell the patient then when to seek urgent medical advice. You have to educate the patients, okay, and when they need to come to hospital urgently. Let's say, for example, you're explaining adult polycystic kidney disease. All right, so you have to educate the patient that these bags or sacs, non-functional sacs in your kidneys, they may get infected. There might be an infection in your waterway system, and these bags get infected. Sometimes stones may form. Sometimes bleeding can happen. So if you notice any blood in your water, or if you notice any pain, or sometimes if you notice any shivering and fever, then you have to come to hospital immediately. All right. Let's say you are explaining whatever disease, okay, which has alarming signs and symptoms. Let's say you're explaining irritable bowel syndrome, okay? So you're following these steps. What is IBS, okay? And then you have to educate the patient that if they develop bleeding per their back passage, or they threw up blood, or they lost weight, or if they had unusual abnormal tummy pain or something, then you have to present urgently to hospital. Again, a patient, let's say with Barry aneurysms, in relation to the polycystic kidney disease, so you have to educate them if they experience severe headache, they have to come to hospital. Severe sudden headache. Okay, maybe it's subarachnoid hemorrhage and he needs to come to hospital. So it's very important that you educate the patient about alarming signs and symptoms. This is that you show that you care about their safety. And so remember, all communication scenarios have a management plan, which you need to explain to the patient. What is your plan of action? What are you going to do now? So clear management plan, when you explain a diagnosis of a disease, includes non-pharmacological management. Of course, if it apply to the given disease, you will do it, okay? Sometimes you are asked to explain celiac disease. Celiac disease is basically non-pharmacological management. It's gluten-free diet, right? Gluten-free diet, period. All right. But pharmacological management may be needed in other diseases, including non-pharmacological management. Let's say you are explaining CKD, chronic kidney disease. Then you have to explain the non-pharmacological management which is needed for these patients, like dietary changes they need to make. If they have hypertension, then also diet. Okay, any lifestyle adjustments needed. Okay, if they need to exercise, like diabetes. Okay, diabetes also includes some pharmacological management, so you have to explain that to the patient, give them a general idea, and then refer to the dietitian. Refer to, for example, if they want to enroll in an exercise program. Okay, you have to give them a general, clear management plan. And then you refer to experts. They are smoking, so you will refer them to the smoking cessation clinic, and so on. So remember, don't pretend and refer to the experts. The pharmacological management is including insulin, steroids, biological agents, chemotherapy, according to your task and according to the disease given to you in the card. All right. If surgical management is needed, then you have to explain it, and that will be provided according to, of course, the disease. If you are explaining a disease where one of the treatment or management modalities of that disease is surgical management, then include it. Other, if present, like physiotherapy, sometimes may be needed, rehabilitation, radiotherapy, defibrillator insertion, catheterization, etc. All right. Then ask about the effect of this disease on their lives and provide help and support. Okay, when needed. So social issues, why do we ask about drinking and smoking, recreational drugs? Because we need to counsel them and give them advice about it, okay? It's important to ask about, so it's not taking social history rather than asking about social aspects, okay? And giving advice in order to control their. If they are having problems drinking, then help smoking as well. Recreational drugs, a patient who was diagnosed with epilepsy, important recreational drugs, okay? Okay, I'm sorry, it seems like my voice is not clear. I'll just fix this. So about so what is meant here with when needed, discuss relevant, which means that according to your given task, okay, give the importance to the relevant social issues to this in this TB, and you explain the anti-tuberculosis medications. It's important to ask about drinking and smoking both. All right. Okay, you should ask about recreational drugs and so, but recreational drugs and sexual problems in a patient who was just diagnosed with TB is not as very much crucial and important as the drinking and smoking here. Okay, what I mean is, to make it more professional, you have to give the priority or organize and order your questions in the social issues according to their relevance. Okay, if they have an independence, like TB, they need to refrain from practicing their work till it becomes mere negative, right? So they have to leave their job for at least 2 weeks. That may cause problems. They may lose their job, all right? So that may cause some financial challenges. Maybe they have some dependents, all right? So this is very important, okay? So sexual problems, you need to ask about these, especially if you are explaining, let's see, or if the patient has paraplegia and he has impotence, or so the importance and relevance of the social issues should be ordered in the priority when you ask. Make the most relevant, then the least relevant, okay? Occupational issues. Okay, I hope you hear me now. Did you hear what I said, or should I repeat? Was it clear what I said about the social issues and how to order your questions according to the most relevant, then the least relevant? Okay, occupational issues. Here he asks about how the disease. Okay, I'll repeat the last thing. Remember when I said that you have to ask about social issues and the effect of disease on their lives and provide support whenever needed? You should make it as relevant as possible. All right, which means that you give the priority. Okay, I'm sorry, the voice is cutting a lot. I see the connection. Maybe I have a connection problem. It seems like internet problems. Just a second. So you order them according to their relevance, okay? According to the given disease, you ask about the social issues and solve any problems they have according to its importance. All right, I'll show you how with the scenarios. Then occupational issues, you have to ask how the disease might affect their job, okay? Like for example, a patient with Raynaud's phenomena or Raynaud disease, let's say, and this patient is working in the fish market and they work with ice. Job is a triggering factor and a causative factor in their complaint, in their disease. All right, so let's say, for example, a patient who is a chef, but she has rheumatoid arthritis. So how does disease affect her job? Well, it's causing her a difficult to contact their occupational health department for specific employment advice or to get help for specific employment advice, to get help or relocation, okay? Okay, now safety of pregnancy is another important issue when you explain a diagnosis of a given disease, all right? Why should we pay attention to safety in pregnancy? Because there are some diseases which has an effect on the pregnancy. Some diseases, the pregnancy has effect on them. And sometimes because of the drugs the patient is going to take, which have some teratogenic effects on the fetus, all right? So here, you need to explain the effect of the disease or the drugs on pregnancy. Effect of pregnancy on the disease. Of course, if it is relevant according to the given scenario, I'm giving you a general outline now, which applies to any given disease in the task, okay? But you have to adjust your performance according to the given disease and whether it's apply or not. So explain effect of the disease or the drugs on pregnancy. Explain the effect of pregnancy on the disease, like cardiomyopathy, for example. If the patient's concern was that she wants to have children after a peripartum cardiomyopathy, you have to advise her not to conceive, because that will cause extra load on her heart and it would put her at risk, her life at risk. All right, severe mitral valve stenosis. Also, pregnancy in a patient with severe mitral valve stenosis. Pregnancy should be prohibited. You should not advise her not to get pregnant unless she had an operation, for example, or her valve stenosis was managed, okay? Then she can conceive. Teratogenic effect of drugs of the given disease and how to avoid them. You need to explain that because you have to ensure safety. Example, epileptic medications, you have to explain the teratogenic effect and the impact it has on the fetus, and you have to explain the precautions to the patient. The same for warfarin, the same for methotrexate, and so on. All right? So this slide explains safety in pregnancy, what you need to ask the surrogate. Remember, if the surrogate was a female, either in history taking or in communication station, okay, please don't forget the issue of safety in pregnancy, especially in communication station. If the surrogate was a female in the history taking station, don't forget to take gynecological history. All right. So safety in pregnancy, you have to ask yourself, is she pregnant now? And you have to ask her too, of course. Is she pregnant now? If yes, let's say that the given disease to you in the task card was to explain rheumatoid arthritis. And you started to follow the steps one by one, and then you reached the management plan and you started to explain the medications, available medications. For example, we were explaining methotrexate. It was given to you in the card that the patient has been tried on a steroid and it wasn't effective. Now you have to explain to her the possibility of starting her on disease-modifying agents like methotrexate. All right. So you have to ask her if she's pregnant at the moment. All right. If yes, explain to her the importance to change her medication and start her on a safer drug to be taken during pregnancy, if not already done. Explain what effects it might have on the fetus. That's why we need to change that. If she's not pregnant, ask her if she's planning to have children soon. Are you planning to have children soon? Yes, I do. I'm actually trying to conceive. So if yes, explain the teratogenic effect of her treatment, if that is the case, and the importance of changing her on a safer drug to be taken during pregnancy. If she answers that she's still not planning to have children at the moment because maybe she's busy with her work or job or study or whatever, explain the importance of being on a safe contraceptive method. Meanwhile, while she is taking methotrexate, as long as she's not planning to get pregnant, then she needs to stay on a safe contraceptive drug, okay, or a safe contraceptive method or agent, okay, so that we make sure that she doesn't get pregnant while she is on methotrexate, and advise her that as soon as when she planned to conceive, she has to come and see her rheumatologist. She has to come to the rheumatology clinic to get her treatment changed, a harm on the fetus, and then she will be sent back to her GP to stop the contraceptive method or device or whatever, and then she can conceive safely. All right, she has to understand this point. You have to educate her about that. That's a warning for her. So she knows that while she is not pregnant for the moment and she is sexually active, then she has to be on a safe contraceptive method. All right? Who is going to do that? You have to send her to her GP. Her GP will keep her on a safe contraceptive. There is some extra point I would like to add regarding, like, for example, drug inducers, like anti-epileptic medications. So hormonal contraceptive pills will not be safe when a patient is on an enzyme inducer medication. Therefore, she needs to be kept on a safe, a more prompt contraceptive method. So that's why you have to include her GP or GP. The GP usually deal with the contraception issues. Okay, so that will make sure that she's not going to conceive while she's taking her teratogenic medications. Okay, so meanwhile, and when she decides to conceive, she needs to tell her doctor to change her own safe drug to be taken during pregnancy. Then the contraception can be removed and she can conceive safely. So take care regarding DD, drug-drug interaction between oral contraceptive pills and other medications, especially enzyme inducers. For the proper contraceptive choice, refer her to her GP or her gynecologist, but GP usually is the doctor who deals with contraception, okay? Some jobs may be prohibited for some patients due to their diseases. So you need to suggest careers advise agencies to offer guidance regarding alternative employment. Let's say someone who will lose his job for good because of his permanent problem, okay? He will not be allowed to practice his job because of his disease. Like, for example, a patient who was just diagnosed with diabetes and he has retinopathy and he has visual problems and he was started on insulin and the DVLA will not let him drive again. For example, his license is going to be revoked. All right. So here, suggest career advice agencies. They can offer guidance regarding alternative employments and training courses, for example. Another way is to contact the social services. All right. They will also help them to find another source of income. When you do that, use a Breaking Bad News approach when doing that. So you have to show a lot of empathy. You have to do it with sensitively approaching the patient and break the news in chunks, give them the golden silence and so on. What about driving issues? It depends on the given disease to you in this scenario. If it is rendering the patient unfit to drive, then you have to advise them to stop driving and they need to report to the DVLA. So sometimes, well, as I said yesterday, we have a lecture for fitness to drive. But in general, okay, let's say that the general outlines, okay, usually any side problems needs to be reported to the DVLA. Okay, when the patient is driving, he needs to stop driving and report to the DVLA. Any problems related to consciousness levels, problems related to, there are of course some exceptions and details, but these are the general outlines, okay? Side problems, consciousness problems, anything affecting the consciousness, either the disease itself like epilepsy or unexplained fainting episodes, for example, or the effect of some drugs like sedatives or like alcohol, all right, anything which affects the consciousness level. Musculoskeletal problems like Parkinson's disease, like let's say ankylosing spondylitis, drugs which can affect consciousness level as well, like insulin, hypoglycemia, antihypertensive medications which are causing hypotension and loss of consciousness, or any drugs affecting consciousness state. Okay? It depends whether if the patient has controlled hypertension with no hypotensive episodes or not. It depends on the given scenario. Okay, also in history taking, when you have the complaint is fainting or loss of consciousness or collapse, okay, among the drug history, you need to check if the patient is taking any one of these medications. All right, what about regarding confidentiality? Sometimes you may be given a disease and there is an ethical or legal confidentiality issue in the scenario. The surrogate tells you, doctor, do I have to tell my husband, or doctor, do I have to tell my employer that I have this disease? So how would you answer? okay? So if the patient had a disease that will not endanger the partner and put him at risk, then it's up to the patient to tell their partner or not. Let's say a patient who was just diagnosed with rheumatoid arthritis, okay? She asks you, doctor, I'm married and I have a question. Do I have to tell my husband that I have rheumatoid arthritis? So rheumatoid arthritis would not endanger her husband. It will not affect him. I mean, it's not infectious. It's not born to bloodborne or something to her husband. So it's up to her to tell him or not. But tell her that, well, it's up to you if you want to tell him or not. It's your decision. But I think that if you told him, maybe he will be more helpful and more supportive. But it's up to you. It's your choice. Okay? If the disease would endanger the partner and put him at risk, and the patient refuses to tell them, like HIV or hepatitis B or C, then try to convince the patient to tell the partner and explain the importance of doing so. If they refuse, I'll confidentiality lecture, okay? If they refuse, then there are issues of breaching confidentiality, and so this will be explained in details in our confidentiality lecture. So the discussion about insurance issue may also arise in such scenarios. It may be So maybe discussion about insurance issues may rise in the scenarios, and that is usually the surrogate's concern, okay? If they asked, I'll tell you what to say. So here is a question. Even if the drug used or the disease itself will affect the children, you mean the pregnancy or affecting their children? Congenital diseases. Well, in that way, okay, regarding congenital diseases, usually we have a lecture to do genetic counseling, okay? But testing the rest of the family or testing the patient, and so must be done with consent, okay? And it has to be freely without pressure. The subject has to decide and choose to get the test, okay? Confidentiality also apply. It's confidential, yeah. Genetic testing and genetic diseases are confidentiality. You have to get the surrogate's consent to tell about the disease, to tell the relatives or so, okay? You're asking about informing the partner about the congenital or the genetic disease. Well, the partner is not going to be affected, okay, directly by this disease. It's about their children. So first of all, you have to do the counseling privately with the patient and try to persuade them to take the test if they have any reasons. I prefer, doctor, to leave it to the lecture because there are some details I need to explain among the lecture, okay? I will give you some PowerPoint presentation first, explanation in the lecture, and then I will answer your question, okay? Because I need to explain some things before that. So don't forget to ask the patient how this disease will affect his life, job, family, and offer help. Ask about their hobbies and recreational activities and how the disease may affect these. When needed, adopt a multidisciplinary team approach involving attention to nutrition, exercise, psychological well-being. Advise the patient about regular follow-up. Arrange an appointment. Provide contact details of the specialist nurse. Consider the use of medical alert bracelet or similar as in Addison's disease, or patient on warfarin, or patient on long-term oxygen therapy, and so on. Address the patient's concern through a direct question. Then give the patient realistic hope according to the given disease. Okay, this is just as a reminder. So these diseases require a medical bracelet. Okay, these are examples: patients who are on drug, insect allergy, food allergies, heart problems, asthma, COPD, kidney failure, diabetes, blood disorders, Alzheimer, dementia, memory problems, breathing disorders, Addison's disease because they are on steroids, warfarin use, some rare diseases, epilepsy, seizure disorder, hearing, visual, or mental impairments, transplant surgery, clinical trial participation, autism, sickle cell anemia, stroke risk, multiple medicines. These are just some examples. You don't have to memorize them all, but these are some examples of diseases which require a medical alert bracelet. Let's say you are asked to explain the diagnosis of Addison's disease. Then it's nice to tell the patient that we give patients who are diagnosed with a similar disease a medical alert bracelet, which carries their diagnosis just in case of emergency. It's going to be well known that you have Addison's disease, so the medical personnel knows how to deal with your disease in case you lost consciousness or something. Don't forget to show empathy, sympathy, take understanding as you go. So now we'll start with practicing case scenarios, okay? This is the block for explaining a diagnosis. Yesterday, I showed you the block for you should use when explaining or when breaking bad news. And this is the block used to explain a diagnosis, okay? Again, this is the interview structure, and this is the skills to key steps for explaining a diagnosis, all right? So we'll start with greeting the patient, confirming the patient's ID, introduce yourself and your role, establish rapport, set the agenda, assess understanding, ask the patient if they have any idea or any expectations, what it might be, if they have any concerns so far. No, then do your task, okay? Explain the incidence, prevalence of the given disease, the normal anatomy, physiology, explain the pathophysiology. Use the pencil and paper you have. Explain the causes, risk factor of the disease, the triggering factors. Explain clinical picture. Explain the complications, including prognosis, according to the given disease. Explain alarming signs and symptoms, and when they need to come urgently to hospital if they happen. Explain if any further investigation needed in the future, and then your management plan. Assess any related social, occupational, driving issue, etc. And then pay attention to safety in pregnancy. If she's a female and her disease in this scenario may affect pregnancy, you need to explain that to her. Or if the drugs or medications she's going to take may affect her pregnancy, so you have to pay attention to that. Give her information about that. Okay, and then assess if she has any ideas, concerns, or expectation. Ask how this information you provided today in this meeting may affect her life, her job, her family, her income, her social life. Would that pose any problems to her? Okay, and then summarize the discussion with your suggestive plan and ask the patient what did she gain from this discussion today. Ask her if she has any questions, any concerns. Are you happy with my explanation today? Do you need me to help you in another way? Do you need me to do anything for you? Okay. And then end the consultation professionally by the 3 steps, which is provide contact details of the specialist nurse of the number 2, written information like pamphlets, leaflets, websites to get more information. Number 3, provide contact details of any medical societies, any group therapies, any whatever you need from that support list. Okay, let's say a patient has diabetes, give contact details of the dietitian, help him. Okay, also the follow-up plan is a part of the management plan, followed by a multidisciplinary team, which is made by a dietitian, a diabetician. Sometimes in the clinic, you will refer him there. So anything you need to refer the patient to, you have to include it at the end of the discussion. All right. And then ask if they don't have any further question in the consultation, thank the patient and wish to see him again. Okay. Then be ready to deal with the like whatever ethical issues included. So this is the plan of explaining diagnosis scenarios. All right, you may face a lot of them in the exam. We will continue with our scenarios. Okay. And so is the voice clear now? I'll follow the practicing list, okay? And I will include the doctors that didn't practice yesterday. I made a list with the names, so we will follow it so that all of you get the chance to practice these scenarios. Just a second. I will call your names, and if you're present, attending live, and you are interested to practice, then please let me know. All right. Dr. Muhammad Adnan, are you there? Are you interested to practice? Dr. Muhammad Adnan. Okay, Dr. Ahmed Taha.
Yes.
Yes. Okay, so I'll show you a scenario. I need you to follow these steps. I'll give you 5 minutes to plan your answer, and then we will start, okay?
Okay.
This is your scenario.
انا عارف بس مش نفس ليه واحد ثابت بعت رسالة عايز حاجة؟ ثابت ابعت لك انت كمان؟ مش هبعت لك جروب بتاع الواتس عايز اشتغل الان. السلام عليكم. وعليكم السلام.
Okay, I can start.
Yes, are you ready?
Hello? Yeah.
Yes, yes. Okay. You can start.
Good afternoon, Miss Marcus.
Good afternoon.
I am Dr. Taha, a doctor in Heart Clinic today. Nice to see you. Hello?
Nice to see you too. Thank you.
First of all, can I confirm you are
Yes.
Miss Gina
Yes.
Marcus, 26 years?
Hello?
Yeah.
Yes, that's me.
Okay, Miss Marcus. Miss Marcus, we are here today to discuss some issue regarding your condition. Is it okay for you?
Yes, it's okay.
Okay. Did you want anyone to attend our meeting today?
No, it's okay.
Okay. Miss Marcus, do you have any expectation or idea about our meeting today?
Well, no.
Okay, Miss Marcus. I received a letter that you had a complaint of awareness of your heartbeat around 3 months back.
Yes, that's true.
And can tell me about this?
Yeah.
Hmm.
Well, everything started, doctor, a few months ago. I was running at the gym, okay? And all of a sudden, I felt my heart racing and I was getting short of breath. And then I was seen by my doctor and I was admitted in hospital during an episode. And then I was told that I have racing heartbeats and that I need more investigation for it. And the doctor, they did a scan of my heart, and I had some sort of something they called catheterization or something. And they told me that I have a very tight heart valve. And then I read about it on the internet, and I don't know, doctor, but I think maybe I need a surgery, right?
Okay, Miss Marcus. First of all, sorry for what happened for you. And that's right, what you told me. And actually, yes, as you know, you did an image for your heart, and this image showed that you have a tightness in one of your valve in your heart. Just let me draw for you our heart is formed of 4 chambers, each chamber connected to another with one valve. Okay?
Yes.
Hello, are you following me?
Yes. Yeah, I'm following.
Yeah. Okay. And unfortunately, Ms. Marcus, we found that one of these valve on the left side, we have right and left side, is tight. Okay, and this tightness making this also a irregularity of your heartbeat and what you feel by racing of your heartbeat, and this some shortage of breath. So our multidisciplinary team from our heart consultant and surgery heart consultant, for your best of the rest, they found that the best thing for you is to do cardiac surgery for you. How do you feel about this, Miss Marcus?
What did you say? Excuse me?
Our
Hello? What did you
hello,
ask
yeah.
me last time? Yeah?
Yeah. Our consultant
Yes,
of
continue,
heart,
doctor, please.
our heart consultant
Yeah.
and the surgery of heart consultant meet together and decide for you as a best of interest
Yes.
They discuss your case and evaluate your case, and they found that to do a replacement of this valve as a surgery for you. How do you feel about that, Miss Marks?
Well, I don't know, really. I mean, do I really need to have the surgery on my heart? I mean, doctor, I feel quite well myself now.
Hello? Hello?
I feel better. I feel better.
Yeah.
I feel quite well in myself now. So, hello?
Yeah.
Yes, can you hear me now?
Yes, now it's okay. Okay, Miss
The
Marcus.
question was, do I really need to have the surgery?
Yes, at the
Do
best of
I
interest.
really need to have the surgery on my heart? I feel quite
Yes.
well in myself now.
Okay, maybe you are feeling quite well now because you are at rest, you are not doing exercise. But for these cases, you have a narrowing of your valve. Per imaging, your area is around only the wideness of your valve is around only 1.4. And normally it is more than 2 or 4 centimeters. So if you did any exercise more or climb stairs or getting pregnant or some infection, you will feel more short of breath and more distress. So for best of your interest, they decide our multidisciplinary team to proceed for this surgery. Hello?
Yeah, I understand.
Yeah.
Yes, I
Yeah.
understand.
How do you feel now, Ms. Marcus?
I don't know. Aren't there any alternatives, doctor?
Yes, our consultant is available. The heart surgeon is available. If you want to discuss this issue with him. First of all, this issue just will explain for you, and if you are deciding, we will arrange a meeting with the heart surgeon doctor. He will explain everything for you. Too much details about the operation or the surgery. Don't worry about that.
Okay.
Okay. So,
Yes.
are you agree about this, Miss Marcus?
Yes.
Okay, Miss Marcus. So I will arrange another meeting with the heart surgeon to give you details about this. But just I will give you some broad lines about this operation and consequence about after this.
Okay.
They will
Yes.
they will change this valve and put another artificial valve. This valve will be the areas okay. Now after operation, you will feel it better. You will feel no more racing, no more shortness of breath. On the other hand, you need to start some blood thinning medication for long life term. And this blood thinning medication has some side effect and you need close monitoring. Uh, as I told you, I will give you only some broad lines and the details will be given later. Hello?
Yes.
Yeah. So, Miss Marcus, we need to follow your um, some labs will be done regularly every now and then to check the correct value for your blood thinning medication and some precaution to be taken to avoid any trauma or any vigorous exercise. And are you planning to get, sorry to ask this special question, are you planning to get pregnant soon or?
Yes. I'm actually. I was planning to get pregnant within the next 6 months or next year. Yeah.
Okay, Miss Marcus. So, if you didn't do the operation, you will feel too much tired and too much shortness of breath. and you will feel the difference if you did the operation and you get pregnant. And if you get pregnant after doing the operation and you are on this blood thinning medication, you should inform your female doctor to stop this medication, or to inform him he will change the medication and start another medication, because this blood thinning medication taken by mouth has some bad effect in your baby. Are you following me, Miss Marcus?
Yes, but I mean, I don't want to go on any medications which can harm my baby. So that's why I'm asking, doctor, can I just postpone surgery after I become pregnant and have a baby?
Actually, if you postpone the surgery, you know, pregnancy itself is making a load on the heart. So more load on the heart, and as I told you, the blood is coming from the side, from our body to the right side, and be pumped to the left side, and already your left side of the heart, the valve is narrow. It will be more load on the heart, and you will feel more tired, and it also will be a more risk on your baby than the blood thinning medication. And this blood thinning medication will not be given during pregnancy. They will, your female doctor will change it to another medication. Can be given, some of them can be given oral, some can be given by injection during the time of pregnancy. Are you okay with that, Ms. Marcus?
Yeah, I think so.
Do you have? Hello?
Yes, yes.
Yeah. Do you have any other concern, Ms. Marcus?
Yeah, I was thinking about the duration of hospital stay, and I mean, how long do I need to be off work if I need to take a sick leave from work? How long does it need to be?
Ms. Marcus, as I told you, this is just only broad line of our management plan, but the details will be decided by the multidisciplinary team of our consultant, heart consultant, and the surgery consultant. He's the one who will decide this duration of sick leave and how long we'll stay in hospital. Generally, you will stay for some days, maybe in intensive care for 1 or 2 days post-operative, and allowing another 1 week in department to monitor your blood thinning medication and everything. This is a mostly, but the details will be the heart surgeon consultant.
Okay.
Okay. Any other concern?
No.
Hello. Yeah. Any other concern, Ms. Marcus?
No, doctor.
Okay. Can I ask you some question? Are you smoking?
Yes, I do smoke.
Okay. I think better for your health to quit or stop smoking, Miss Marcus. If you want, I can refer you to our smoking cessation clinic.
You have 2 minutes left.
Okay. Are you drinking alcohol, Miss Marcus?
Sometimes, just socially.
Okay, Miss Marcus. And just let me to, what's your job?
I'm a solicitor.
What?
A lawyer. It's okay to say a lawyer. Lawyer,
okay.
lawyer.
Okay, and what you have now, it is affecting your job, Miss Marcus?
No, so far, no, I don't think so. Just regarding the sick leave and the arrangements for the operation. That's it.
Okay, Ms. Marcus, as I told you, it will be arranged with the heart surgeon consultant. So just to summarize our meeting today, that you have racing of your heartbeat and imaging done for your heart. show it that you have a tight in one of your valve of your heart, and our multidisciplinary team show in the best of your interest to change this valve with an artificial valve. Then maybe you will need another blood thinning medication, and there is some precaution regarding this blood thinning medication will be given for you by our team after operation. Okay, Ms. Marcus?
Okay.
Okay, can you tell me what you get from our meeting today?
Okay. Did you finish?
Can you tell me what you get from our meeting today?
Well, that I have a tight heart valve, and I must have a surgery, and also after the operation things will get better, and that I need to take some sort of medication after the operation, which has some precautions with pregnancy and having babies.
Yes.
And that you'll explain that fully to me after the surgery.
Yes, and details will be given by the team afterward. And I will
Yes,
give you
Thank
the
you.
contact hospital number, and there is some leaflet and some site of internet to read about this disease and about the operation. Okay?
Okay. Yes.
Anyone will, you can drive home, or I can arrange a taxi for you, Miss Marcus?
No, it's okay.
Okay, Miss Marcus. Any other concern? Feel free to ask me any question.
No, thank you.
Okay, thank you, Miss Marcus.
Okay, thank you. So what are the ethical issues in this scenario?
Ethical issue, autonomy.
Yes.
Autonomy. Patient has right to know about her condition and decision about going OR or operation or no.
Yeah.
Beneficiary will do the benefit of the patient, malbeneficence to avoid any harm for the patient, and justice treat the patient regarding their color or race or religious.
Doctors, you did very well. Okay, thank you very much, and you finished on time. You did your task very well. One thing I would like to clarify one more time. Regarding ethical principles, okay, we have 4 ethical principles. In most communication scenarios, the first 3 principles usually apply to most communication scenarios, like respecting patients' autonomy, beneficence, and non-maleficence. These 3 apply to most communication scenarios, but justice is not applying to all scenarios or to the most scenarios like the previous 3 ethical principles. In some scenarios it applies, in other scenarios it doesn't. So try to avoid saying justice unless you are very sure about it, okay?
Okay.
And that you can justify your answer, because that may lead to questions, and the examiners start to ask you questions which you cannot answer, okay? So safely, the first 3 principles usually apply to most scenarios, but justice, it depends. If you feel in the scenario that justice apply, then say it. Like yesterday's scenario about mesothelioma, for example, justice applied, so you can say justice, all right? Unless you are sure about it. If you are sure about it, then you say it, okay? You did very well, thank you very much. Just one thing, the female doctor, do you mean the gynecologist?
Yes.
I don't know if it's called female doctor like that. You are avoiding medical jargon, okay? So I think you can say your woman doctor.
Okay.
Right? I think they call it a woman doctor. Or you can say a gynecologist, which is the woman doctor. He is the doctor. Explain it. If you say gynecologist, say, don't bother with the term, it is the doctor who treats women
Okay.
or woman doctor. I think it's woman doctor, not female doctor. Okay, as a jargon, to avoid the jargon. Then there was, you explained everything very well, even the blood thinning medication, in that she needs to go on another form of blood thinning medication, which is heparin. You meant heparin, right? Injections during pregnancy,
Yes.
if she got pregnant. When she asked you about any alternatives, you did it very well. You said that there are some alternatives, and you can arrange a meeting with the surgeon to explain to her the details of the